We talk a lot about how oral health connects to overall physical health, right? But what about its link to something maybe a little deeper, like a patient's actual happiness? Well, today we're diving into what a brand new 3-year study has to say about that very connection.
Think about it. As a clinician, you're improving smiles and restoring function every single day. But what's the impact beyond the chair? Does the work you do measurably, quantifiably increase your patient's happiness? It's a pretty big question.
And look, this isn't just some feel-good idea or a vague theory. We actually have a compelling, data-driven answer, and it comes from a major new study in the Journal of Dentistry. So let's break down exactly what they found.
Okay, so let's get into the specifics of the study itself. This was a 3-year-long happiness study, and it was laser-focused on one thing, really examining that link between a person's oral health and their overall well-being over a good chunk of time.
And what's really incredible here is the sheer scale of this thing. We're talking about a study that followed almost 54,000 Japanese adults, all over 65, for 3 full years. The goal was simple, but man, was it profound, to track exactly how their oral health was affecting their happiness day in and day out.
So after all that time, all that data, what was the big takeaway? Well, the headline finding is actually pretty straightforward, and it's incredibly powerful. Having more teeth directly correlates with less unhappiness.
And the numbers, they really paint a crystal clear picture. Over the 3 years of the study, nearly 25%, a quarter, of adults with 9 or fewer teeth and no prosthesis reported becoming unhappy. Now compare that to those with 20 or more natural teeth, that number drops all the way down to just over 15%. That is a huge difference.
In fact, let's just boil it down to one key number. After the researchers adjusted for all the other factors, they found that patients with 20 or more teeth had a 20% lower risk of becoming unhappy. This shows that tooth retention is a massive protective factor for a patient's long-term well-being.
Okay, but what about our patients who have already experienced significant tooth loss? Well, the study found something really important for them too. For those with fewer than 20 teeth, using a dental prosthesis, dentures, bridges, also had a clear protective effect. It helped to buffer that risk of unhappiness, which just goes to show the immense value of our restorative care.
So we know that there's a link, but this is where it gets really interesting. The researchers wanted to know why. They decided to dig deeper to try and uncover the real reason behind this connection, and trust me, the answer might actually surprise you.
It all comes down to this question. What is the actual link here? What's the pathway that connects losing your teeth to a decline in your happiness?
And here it is. This is one of the most fascinating findings of the entire study. The researchers looked at 3 potential reasons, and what they found was that having difficulty speaking and difficulty chewing, those were the things that explained the link. But, and this is the kicker, having problems smiling or being self-conscious about showing your teeth did not explain the connection. It wasn't about aesthetics, it was fundamentally about function.
And you don't have to take my word for it. The authors themselves spell it out right there in the paper. They wrote that in this older population, people were just less concerned with their social image or how they looked. Instead, they placed a really high value on the functional parts of oral health, the ability to speak clearly and to chew properly. That is such a critical insight for how we talk to our patients.
Okay, that's the science. So what do we do with this information? How do we translate these incredible findings into what we do every day in the practice? Let's talk about the key clinical takeaways.
It all points to this, a more functional approach to patient care. So, number 1, we double down on prioritizing tooth retention, reinforcing its huge impact on long-term well-being. 2, when we talk about prosthesis, we frame the benefits around core functions, like speaking and socializing, not just eating. 3, we can discuss the real-world social impact of treatment. And finally, 4, we can explicitly connect the work we're doing to the patient's overall quality of life and happiness.
So what does this actually sound like in the chair? It means we can shift the conversation a little bit. We can start saying things like, this treatment will help you speak more clearly with your friends and family. Or how about restoring your ability to chew can help you fully enjoy those social meals again. See, we're framing our work around the very things that bring joy and connection into our patients' lives.
When you boil it all down, the message here is huge. It shows that the work you do goes so much further than just fixing teeth. It's about restoring fundamental human functions, enabling social connection, and directly contributing to a happier, more fulfilling life for your patients.
So this leaves us with one final thought to take into your next patient consultation. How are you going to discuss happiness and well-being when you present your next treatment plan?